As a country, Malaysia has over 750,000 confirmed COVID cases, with over 900 still battling for their life. A lack of medical equipment has been devastating as Tzu Chi Malaysia chapter donates supplies to a few hospitals. Here's more.
In the past year or so, COVID-19 continues to wreak havoc on a global scale. Malaysia's Tzu Chi chapter volunteers remain calm and continue to offer support when needed.
During the first stage, we bought them face shields and handmade face shields, PPE, and masks for them. In the second stage, since patients' numbers are high and medical equipment are lacking, we are providing needed medical supplies.
The third wave of the pandemic began in Malaysia, and an increase in confirmed patient numbers has risen since April of 2021. Patients with severe symptoms are also increasing, which means many of the hospitals around are not equipped to handle this sudden influx of patients and lack medical supplies of all kinds. When Malaysia Tzu Chi heard of the situation, they began a COVID Relief 2.0 campaign in May.
We talked to the hospitals directly and asked them to give us an itemized list of what they need. Honestly, all the items are on everyone's list, including the government. This is why there is such a lack of supplies of it on the market. So how to communicate with respect and love so as not to harm them is the biggest challenge of all.
Just like putting out a fire when lacking proper equipment, saving lives becomes a challenge.
Doctors need the equipment to monitor the patient's status, their heart, their oxygen intake levels, and such.
Take Pantai Hospital, Malaysia, for instance. In the ICU, there are 4 beds and no oxygen machines. If one of the patients has trouble breathing and there's no equipment to help, then he's out of luck.
Tzu Chi volunteers and team members from each region mobilized to communicate with their respective hospitals. And in just 1 month, they were able to donate supplies and equipment to the following places: Penang General Hospital, Pantai Hospital in Sungai Petani, Raja Permaisuri by Noon Hospital, COVID Center in Catalan State, and Johor Bahru's Sultan Ismail Hospital. As of June 30th, 8 more hospitals are still in talks. Tzu Chi's donated equipment includes high-flow nasal cannula tubing, oxygen tanks, syringe pumps, electric dust filter respirator, vital monitors, hospital beds, and monetary funds to over 38,000 families.
This handing over is in need of time, and it came in the right time. Majority of the patients, sometimes with the medical therapy, include support with this oxygen. They can recover without getting into ICU.
No matter how much of equipment we have, it still won't be enough because the cases continue to come in. Patients are very ill. We hope that with better equipment and more facilities, a lot of patients can be helped.
On behalf of our hospital staff and workers, we thank Master Zeng Yan with all of our hearts. Thank you for your support for us. If we had to purchase this amount of equipment, it would have put a strain on our budget. Tzu Chi has provided us with plenty of love and support, and we will spread that to our medical staff.
Volunteers also provided vegetarian lunches for the medical staff to take care of their health and as a way to thank them for their dedication during this time. Also, a countrywide donation campaign has begun where volunteers are inviting members of the public to gather their thoughts and prayers for the frontline healthcare workers so we may soon see an end to this pandemic.